Oh, that's great. Wow. That's quite a lot. And I love the way you frame that because we think of traditional healthcare as just benefits to go to the doctors, but it's more than that. It's like, mental health days, basically. We used to sort of sneak and take those mental health days, and now you've incorporated and more companies are doing that. So I want to go to an audience question and ask both you, Nina, and Tim to answer it. So this question comes from Lorraine, and she says, "How are employers and insurance companies assisting the long haulers? Are long-term disability claims being approved or denied due to, in many cases, inclusive test results?" So, those people who've had it and now have some issues. Tim, can you answer that first, and then Nina, maybe follow up?
Yeah, sure. What we're seeing with employers, and what I love about it, I'm going to tap on what Nina said for just a second, which is you have forward thinking of employers who have really recognized that they're shattering the glass between what used to be work slash life, and now it's just life. You basically have a work environment that exists inside of your home, and you have to accommodate for all of the spectrums of what occurs inside of that environment. And a lot of forward thinking employers, such as LinkedIn, you've got Disney, you've got Starbucks, are out there saying and asking the right questions, going, how can we support our employees to have this holistic full life? Specifically in the question on long haulers, I think there's a lot to be determined, to be completely frank. I see a lot of forward thinking companies, a lot of forward leading companies such as ourselves that are of course making accommodations to ensure that the employee who is individually affected by either a long haul case or the COVID-19 pandemic are getting the time that they need. Now, it may either be for themselves in terms of the healthcare they need, the insurance coverage that they need, in terms of having the support mechanisms in place to ensure that, as you mentioned, Michelle, health is checked off from an insurance and benefits perspective. But also, I'm seeing a lot of companies lean into the support structures of that as well. Compassion care, making sure that you can take time off to take care of your loved ones. I have a lot of parents who are sitting there going, what do I do if my child catches COVID? Because I don't have a policy at work for taking care of paid family leave for those that are not directly employed by the organization. A lot of forward-thinking companies, a lot of leading organizations, such as the ones that we have that we work with at care.com, are thinking outside the box and saying, how do we create and envelop a care spectrum and a package of benefits that actually handles everything instead of just this one piece of the benefit puzzle?